Now an update on a story that we've been following closely all year. In Colorado, children needing mental health support have been forced to wait months or longer to get the help they need.
Providers point to insurance companies and say they're creating unnecessary hurdles. Those same providers highlighted one company in particular, Anthem. CBS Colorado investigator Karen Morfitt uncovered this growing issue back in April and has an update for us tonight on changes that are now in place.
These are small changes, but have already helped alleviate those long wait lists and get children access to the care that they need. Changes made by insurance companies and a continued push by the Division of Insurance to try and make policies more transparent and ultimately more competitive.
Two mothers, both with children trying to access mental health care, both stuck on wait lists with hundreds of other families.
I'm so desperate to find care for her. I shouldn't have to wait.
They shared their stories back in April, and less than a year later are seeing relief.
Our wait list now is down to 25, and we have families that are getting seen and getting services.
Blair Skinner, director of Early Childhood Wellness Place in Broomfield, was one of the first to raise concerns. Providers claiming private insurance companies, specifically Anthem, one of the state's largest insurers, were not only slow to bring new staff in-network, but unlike other companies, wouldn't allow what are essentially residents to take patients. We asked the state if that needed to change.
In terms of the pre-licensure work, I think that is one really interesting and potential creative solution.
Since that discussion, Care Achievers with Colorado's Division of Insurance says they have issued a formal recommendation that all companies allow supervisory billing, launched a new transparency tool to help providers better understand policies, and created a new way for reporting concerns.
The conversation that we had certainly highlighted certain issues, and it really added to this kind of collective conversation we're having around how does a consumer get the care that they need when they need it.
Skinner says Anthem is now allowing some pre-licensed staff to bill, but not all.
This is the way that we replenish the field for any kind of medical, right? I mean, that's what they do in hospitals. That's what doctors do. That's how they learn.
While the movement they've seen in a matter of months is beyond helpful, Skinner hopes it is only the first step of many.
We've made leaps in the right direction for sure. We're not all the way there, and so we're not going to stop pushing.
The State Division of Insurance has created a new place for behavioral health providers specifically, where they can raise concerns or file complaints and make the process more front and center for patients as well. We have all of the information on that online at cbscolorado.com.
In addition to the CBS Colorado investigative team, Karen Morfitt is also your reporter in Jefferson County. She's invested in the community and lives there with her husband and two children. If you have a story idea or a tip for her, send her an email through our website or give her a call on our tips line.